Welcome back, guys. Now let's see carbon dioxide transport. Already we have discussed about the oxygen transport, how oxygen is being transported to the tissues. Now carbon dioxide transport. Guys, look at the basics. Here I have explained you. See, oxygen is mainly transported in 97% of the oxygen is mainly transported in the form of oxyhemoglobin. Most of the oxygen it is traveling along with the hemoglobin. Only 3% of the oxygen it is dissolved in the plasma. Okay, we all know that. But if they ask you what is the major form of carbon dioxide transport, see, most of the carbon dioxide, okay, that is 70% of the carbon dioxide, it is transported in the form of bicarbonate. So carbon dioxide will be converted into bicarbonate form, and these bicarbonate, where are they present? They are traveling in plasma. Okay. So this is a very important MCQ. Most of the carbon dioxide is transported in which form? 70% of the carbon dioxide is transported in the form of bicarbonates in plasma. Let's see how this is happening. Look at here. We all know our tissues. Okay, here is our tissue. We all know tissues, they will take up oxygen. They will use oxygen. And what do they produce? They produce carbon dioxide. So, okay, carbon dioxide produced. Finally, carbon dioxide produced, and we all know carbon dioxide is a gas, it's a lipid soluble substance. So, carbon dioxide is going to go from the tissues, it is coming to the blood. So, yes, carbon dioxide entered into the blood. This is the venous blood now. Now, where do you think the carbon dioxide will go? Straight away, the carbon dioxide is entering into our RBC. Okay, carbon dioxide is going to our RBC in the venous blood. Now, what this carbon dioxide is going to do? See, the carbon dioxide is going to react with the water in the RBC. Okay, anyway, in the cytoplasm, water is going to be there, right? So, carbon dioxide reacts with the water, and you know what will happen? It's going to form H2CO3. Okay, see H2CO3, H2CO3. So, this is a carbonic acid, and what is the enzyme required for the fusion of a carbon dioxide with water? It's a carbonic anhydrase. With the help of the carbonic anhydrase, finally H2CO3 is produced, carbonic acid. Now, this carbonic acid is going to split into, okay, H2CO3 is going to split into bicarbonate and H+. Okay, bicarbonate and H+. So, look here, finally we have produced the bicarbonate. Now, within the bicarbonate, who is present? Carbon dioxide is present? No, within the bicarbonate. So, yes, most of the carbon dioxide is converted into bicarbonate form. Now, these bicarbonates, see, they are going into the plasma. Have I told you bicarbonates are traveling in the plasma? Yes, so bicarbonate is coming out into the plasma. For exchange of this one negative ion, if you want to send one negative ion, okay, if you want to send one anion out of the cell, you have to bring one anion into the cell for electron neutrality, for the balance. So, who is coming in? Chloride is coming in. Chloride is coming into the cell. So, this is also called as chloride shift. Okay, it's a recent question asked in the exam. It's chloride shift, also called as hamburgers phenomena. Hamburgers. Okay, hamburgers phenomena. So, now tell me, hamburger phenomena is exactly happening in which blood? It's happening in the venous blood at the level of tissues. It's the exchange of bicarbonate for the chloride. So, in your exams, they will ask you, bicarbonates are exchanged for which ions? Bicarbonates are always exchanged for the chloride ions. Okay, bicarbonates exchanged for the chloride ions. So, done. But during this process, something bad happened. Okay, sir, we got this bicarbonate. Okay, that's happily traveling in the plasma. That's fine. But during this, something bad happened. What is that? H+. One H+ is produced. It can lead to decrease in the pH within the RBC, and that's very bad. See, do you think only one carbon dioxide molecule is going to be there in the RBC? No, there are thousands and thousands and thousands of molecules of carbon dioxide is going to be there. So, these thousands and thousands of carbon dioxide molecules going to produce thousands and thousands of protons, and these protons, what they can do? They can lower the pH, and that can lead to the damage to the RBCs. So, we don't want to keep this H+ alone. Okay, we should never keep this H+ alone. So, who is going to accept this H+? So, this H+ is immediately accepted by a buffer in the cell called as a hemoglobin. So, this Hb is nothing but the hemoglobin, guys. So, this hemoglobin, it is having an amino acid called as a histidine amino acid. Let's imagine these red color things. This is an amino acid called as a histidine. Okay. So, what this histidine is going to do? This histidine is going to accept the H+. It's going to bind with the H+. It will accept the H+. So, the H+ will be neutralized. It's no longer free. Only free H+ ions going to contribute to the pH. So, once the H+ is bound with a protein, so it's no longer going to contribute for any pH. Okay. So, from this, if they ask you what is the most important intracellular buffer, the most important intracellular buffer is the hemoglobin. So, hemoglobin is acting like a buffer because of the presence of which amino acid? It's because of the presence of histidine amino acid. Okay, done. So, yes, happily now these RBCs and the bicarbonates are traveling in the blood and going to the lungs. So now finally this venous blood finally where it will come? The venous blood from the entire body have to come to the lungs for the purpose of oxygenation. So yes, now we are talking at the level of lungs. Okay, we are at the level of lungs. Now what is happening at the level of lungs? See, at the level of lungs, who is going to come? It's the oxygen. Oxygen is coming. So whenever there is oxygen availability, okay, so oxygen is more precious for the hemoglobin, right? So whenever the oxygen is coming, oxygen comes and binds with the hemoglobin. Now it's the binding of oxygen to the hemoglobin decreases the affinity of the hemoglobin for the carbon dioxide. Okay, see, now once the oxygen is coming and binding with the hemoglobin, do you know what the hemoglobin is going to do? Hemoglobin is going to immediately release the H+. Previously, hemoglobin is binding with the H+ ions. Okay, now this oxygenation is going to cause the release of H+. H+ is removed. Now you should never keep this H+ alone because we know this is an acid, it can cause damage. So we should never keep it alone. So to buffer this H+, again bicarbonate is coming into the cell. Okay, now the bicarbonate is coming into the cell. In exchange, chloride is going back again into the plasma. Okay, again. So this is also chloride shift, but reverse chloride shift. Okay, reverse chloride shift. So this is reverse chloride shift. So reverse chloride shift occurring at the level of lungs. So whenever there is more partial pressure of oxygen, whenever there is more oxygen available, so oxygen will come and bind with the hemoglobin. So immediately hemoglobin affinity for the carbon dioxide in the presence of oxygen, hemoglobin affinity for the carbon dioxide decreases actually. Okay, so it's going to immediately release the H+. Okay, so now once H+ is available here, the bicarbonate is going to again come back. So now you tell me HCO3 is going to react with the H+ with the help of again enzyme called as a carbonic anhydrase. Now it's going to form H2CO3 again H2CO3 is produced. See, H2CO3 produced. Now this H2CO3 again with the help of a different type of a carbonic anhydrase, it's going to again split into carbon dioxide and water, again going back to original forms, carbon dioxide and water. Finally what we have regenerated? We have regenerated the carbon dioxide. Okay, again carbon dioxide form. Now where this carbon dioxide is going to go? Now here we are having lots and lots of carbon dioxide. Now the carbon dioxide from high concentration will automatically go into low concentration. Okay, so now carbon dioxide is going to be excreted out. So this is how carbon dioxide is transported. So two important questions for your exam. What is the most important intracellular buffer? Hemoglobin. Because of presence of which amino acid? Histidine amino acid. Where do you think the chloride shift is going to occur? Chloride shift, also called as a hamburger phenomena, is going to happen in the venous blood at the level of tissues. Okay, bicarbonates are exchanged for which ions? Chloride ions. Okay, so these are the very important things which I wanted to know. See, can I say something like this? It's a binding of oxygen. It's a binding of oxygen finally leads to release of carbon dioxide from the RBCs. Who is going to be released? Carbon dioxide is going to be released. So it's a binding of oxygen decreases the affinity for the RBC to carry this carbon dioxide, or you can say it's a binding of oxygen decreases the affinity of the hemoglobin to carry the carbon dioxide. This is called as what? Haldane's effect. Guys, previously I have explained you what is Bohr's effect. Bohr's, which letter is there? O is there. Bohr's is the release of oxygen. Bohr's is the release of oxygen. Then what is Haldane's? Haldane's effect is the release of carbon dioxide. So look here, loading of oxygen means when you load the hemoglobin with oxygen, loading of oxygen to the hemoglobin leading to the release of what? Leading to the release of carbon dioxide to the lungs. So this is called as Haldane's effect. So these two are very important for your exams. What exactly is Bohr's and Haldane's? Bohr's is the release of oxygen to the tissues. Haldane's is the release of carbon dioxide to the lungs. Okay. So with this, successfully what we have completed? We have completed the topic of carbon dioxide transport also. Hope the video is helpful. Thank you.